Hey, Dr. Lindsey here. This video is a 5-week update on a youngish Middle Eastern guy who went to a local doctor, had a first strip case that resulted in almost no growth, went back and had a second case. The strip was harvested too low on the back of the head, it widened out, and the fellow did not get much density. He came over here and shopped for a while. We talked to him, and I think he saw 1 or 2 cases that we'd done. And so 5 weeks ago we trimmed him down, excised a small strip from above his old scar, and sewed him up, got 1,350 grafts, and packed his frontal hairline. And he came back today for a scar check. My scar looks good. Hopefully it will stay looking good. His old scar looks like it used to look, which isn't so hot. We had talked about excising that or not excising it, and if you follow this all the way to the end of the video, you'll hear some of that debate. Anyhow, he looks like he looked 5 weeks ago, which means we're back to square one, except that now he has 1,000, 1,200, 1,300 grafts packed in that frontal hairline that are now resting, and next summer will be growing, most likely. So he lives pretty close by. I've asked him to come in 6 months and to pop in next fall so we can get a final set of pictures on him. These cases are really gratifying because they almost always turn out well, assuming that you take care with the grafts, get things done in a timely fashion, and do reasonable cleaning post-op. It takes a little longer on repair cases, and there's also a nervous component. Patients who have been, had poor results before are always more nervous that they're going to have crappy results again, and so it's a lot of preparation, expectation management, and getting enough Valium so that the blood pressure is low the day of the surgery, and they're not laying there worrying about things. But I expect this to turn out well. You never know until the year's up, but we've got a good track record with these repair cases, and so take a look at this. And following the short video of him at today's visit, it's the full video of his surgery a few weeks ago. Thanks. Okay, so this fella was a repair case that I put a video up of about a month ago, and lean forward just a little bit more, good. And remember, we sewed up to his old scar, which is the wider thing down below, and then my little pink line is right above it, and he's a month out, and that's what it's supposed to look like. Still pretty numb back here?
No.
Alright, and then pull your hair back if you would, and I will be careful not to hit your face. Turn a bit towards me, please. So, my guess is that most of what you got up here is a combination of hair that you'd gotten elsewhere and a few remaining stragglers that I put in. As we were just talking, you probably lost everything you're going to lose. You'll start looking a little bit better in about a month or so, and then you'll start really looking better probably in 4 months. So this is a repair case. He had 2 surgeries done elsewhere. The strip's put too low on his head. Can you show that? And the scar's wide. So we had a long talk about whether to do a completely new strip up where they ought to be, or to cut this one out. And there's no right answer. The advantage of taking this strip out, or this scar out, is you only have 1 scar, but it's a kind of a crappy scar in a bad location with weaker hair. And the argument for new scar up in normal location is better scar probably, and certainly better hair, but with the downside of 2 scars. So we agreed to excise just above his current scar. We'll sew up to that and get good quality hair. It's a small repair case, so I think we can get him a decent scar and decent hair. Okay, so the strip came out easily, didn't bleed much. And this is where we're going to put the hair. We're just going to pack that first 1.5 centimeters and try not to hit and hurt any of the hairs he's paid for elsewhere. It's just not dense enough. Okay, so we got this fellow pretty much numbed up on the front. And trim the hair so I can get real close and make holes between these low density grafts here on the side and just pack it. And although I'm going to do my best not to hit any of them, we'll probably hit a few, but more likely is just the trauma from me making the holes and the girls putting in the grafts. About a month from now he's going to have some good shock loss in this 1 centimeter. But 2 months, these hairs will be back, and 4 or 5 months the new stuff will start to kick in. So I've made all the holes as close as I can to the grafts that he's already paid for. And you can see that right here, there's just not much density, but there's a bunch of holes there. We get these hairs in, we just put the PRFM in, and this should turn out good. So we just finished up packing, and the reason it doesn't look quite as dense as the virgin head is because there's areas where he doesn't have any grafts, and that's where he had hair before, where we worked around those hairs. That should do well. And we got 1,397 grafts, which is more than we needed from a thin strip, so this should turn out good in 13 months. Okay, so this fella's now a week out, and he's done a great job cleaning. You can see where we did our scar, and that ought to turn out well. I just have tried to beat it into his head. He needs to use vitamin E twice a day, and although the scar's a little on the low side and we sewed right up to his old one, I think if we do that, he's not going to get any worsening of the scar. Maybe we get a little improvement in his old scar. And his hairs covers it well. So he stayed at a hotel all week and doesn't want anybody to know. So what we did was we just left this hair long in the front, and you can't see anything that's going on. And when you rub your hands up there, so hey, look there. He's got. I mean, this guy has done one of the best cleaning jobs ever, and I was a little worried about that. You know, I'm always stressed when these guys that are repair cases with high IQs come in here. They're not going to listen to me, but that is perfect. There's no reason this won't work. It's just a time game.